Internal medicine is a core clinical discipline of TCM. Historically, medical practitioners have placed great emphasis on the study of complex internal medicine diseases, as discussed in the Huangdi Neijing, accumulating a wealth of experience. The Huangdi Neijing states that the lungs govern the skin and hair, the heart governs the blood vessels, the liver governs the tendons and fascia, the spleen governs the muscles, and the kidneys govern the bones and marrow. A prominent feature of the Huangdi Neijing is its embodiment of holistic concepts and syndrome differentiation and treatment. It recognizes internal medicine diseases from physiological systems such as the Zhangfu organs, meridians, qi, blood, body fluids, and factors like wind, cold, summer heat, dampness, dryness, and fire. It also considers the clinical manifestations of diseases, laying the foundation for the classification and naming of internal medicine diseases in later generations. For example, the Huangdi Neijing states that all trembling and dizziness caused by wind diseases belong to the liver. All muscle and vein cramps caused by cold diseases belong to the kidneys. All irritability and depression caused by qi diseases belong to the lungs. All swelling and distension caused by damp diseases belong to the spleen. All pain, itching, and sores belong to the heart. All reversed flow of qi, blockage or incontinence of bowel and bladder functions belong to the lower burner. All asthma, reverse flow of qi, and vomiting belong to the upper burner. Furthermore, all blurred vision and limb convulsions caused by heat diseases belong to fire. All inability to open the mouth, chills, and clattering teeth belong to fire. All qi rushing upwards belong to fire. All restlessness, mania, and abnormal behaviors belong to fire. All swelling, pain, soreness, fright, and unease belong to fire. This text illustrates the TCM approach to understanding and treating various internal diseases, emphasizing the interconnection of different bodily systems and the influence of environmental factors. Any condition with abdominal distension and enlargement is attributed to heat. Any disease with sounds like intestinal rumbling upon palpation, producing drum-like sounds, is attributed to heat. Any twisting and cramping of muscles with turbid discharged fluids is attributed to heat. Any vomiting of sour fluid or sudden diarrhea, accompanied by a feeling of distress, is attributed to heat. Sudden onset of symptoms of rigidity is attributed to wind evil. Any clear, cold discharged fluids are attributed to cold. Any cramp or stiffness in the neck and nape is attributed to dampness. From the perspective of guiding clinical application, the classification of internal diseases is mainly based on their causes, divided into two major categories: externally contracted diseases and internally generated diseases, each with different clinical characteristics and pathogenic changes.